So Burwood Group is a company that primarily works with healthcare organizations around bridging clinical and IT strategy. We do a lot of work around helping with clinical IT adoption, workflow improvement, as well as helping map strategy to execution. Burwood got involved with Rush primarily to help bridge the gap between clinical and IT initiatives. They had a project team that was together that was focusing primarily on the technology implementations. We got involved primarily around program management and helping the organization both build a transformation plan as well as an execution plan to move into the new facility. So we were brought in to really bridge that gap between the facilities, IT, and the clinical staff to help really help ensure that the success of the project and the go-live dates were met.
Burwood has been excellent to work with on our project of implementing the tower and getting things off the ground. We worked with them in a number of aspects, from helping us develop workflows for our clinical communication system through the training. When we got to the point where we were developing content for the training and developing this method of passport training that we used, we realized that I wasn't going to have enough experts in our department to be able to provide all this training.
Having the training not only planned, but having the training executed well was very essential. And the Burwood folks really, because they were part of the build, if you will, of the workflows and the processes related to the clinical communication system, they were in a perfect position to develop the training materials and execute the training for us, accompanied with the electronic learning tools that they're leaving with us, which will be fundamental, and they'll be how we orient new staff as we hire them on and teach them about many aspects of the building.
I think everything that we've done in terms of the technology and the tower has been with the patient in mind. And every process that we've put in place, we've kept the patient ultimately as our focus.
As a nurse, I think it's very important that nursing has a voice in how technologies are deployed throughout healthcare systems. Burwood Group, having a nurse on staff, gives that insight into how clinicians can use and will use the technology that they're being provided. Having representation that can walk the walk and talk the talk with clinicians provides a lot of credibility to an organization like Burwood Group.
When you look at healthcare as an industry, there are really two main drivers that hospitals are dealing with today, or two major trends. One is to improve patient safety and the quality of care to our patients, and a competing driver of reducing cost. And those two drivers together are fundamental challenges that sometimes cause great strains for an organization. So I think organizations have found that there are opportunities to look at how we invest in technology in a way that's purposeful and focused, that helps accomplish those outcomes. It allows organizations to both address the quality of care and safety equation while at the same time affording organizations the opportunities to be able to address the cost equation. I think the main thing that organizations see value in is the fact that we really work as a part of their team, that we really seek to understand their organization, and we're there to make them successful and help make them successful in their adoption of new solutions, technologies, or workflows as it applies to, especially as it applies to moving into new facilities.